Hello, my name's Jillian from Queensland, Australia. I'm in my 40s and diagnosed in 2010 with DCIS, invasive cancer. I had a modified mastectomy, was ER positive and node negative. And I would like to share my tips on getting through the surgery phase of the breast cancer journey. In reflection of the surgery phase for me, there were 4 or 5 issues that I encountered. The first was that it's still overwhelming, and that's an overflow from the diagnosis phase. There is so much to know, so much to learn, so much to understand. So how do you do that? The second is the waiting that is constant. There's waiting for the surgery day, and then there's waiting on the day of surgery, and then there's waiting for your pathology results that come a couple of days afterwards. The third issue was around my breast. So when do I look at my breast? When do I check out my surgeon's artwork? And then there's the bra dilemma. When do I solve the bra scenario? What will I wear? Can I wear things that look pretty? What's going to make me feel good? So, and how soon should I do that? Then there's the post-operative recovery. What can I do for myself that can speed up my recovery? Now I'm looking at chemotherapy in about a month or two's time. So how can I fast track my recovery for that? And the last one is a bit of cording that I experienced a month after surgery, which is the tightening of your lymphatic tissue, which has resulted from the removal of some lymph nodes. And how do you deal with that? So they're the issues I encountered. The surgery phase is just as overwhelming as the diagnosis phase. So Bruce and I continued to research to make sure that we had a complete understanding of what was going to happen during the day of surgery, including the sentinel node testing and what those options would be based on the outcome, and also post-surgery, what to expect in the recovery phase of surgery. Bruce did that with me, which was great because at no point did I actually feel like I was alone by myself doing all of this. So it was great to have him right beside me. So that's a good tip. I can honestly say the day of my surgery was the longest day of my life. We had a 7 a.m. admission and a 9 p.m. surgery. It was a long day. And I took a number of things to keep myself occupied, but certainly not enough. And your mind tends to play some games on you through the day. So the more things that you can have with you to keep you occupied, the better you'll be. The breast care nurses offered me a DVD and a bunch of videos to watch, which was really helpful because I could get totally enthralled in the movie. But it was still a long day. And about 4 o'clock, there was a couple of people left in the waiting room, and I was starting to struggle. So we asked the nurses if there was any chance that we could be admitted up to the ward. And they did that, which was really good. So they settled us into the ward, and that was good for a couple of hours. But by about 7 p.m, I was going really grey, and I was really struggling, thinking about how I was going to cope with this, and I was very anxious. So I ducked around to the nurses' bay and asked if I could have the pre-medication that you would normally have just prior to your operation, but if they would give that to me earlier. And they did, which was fantastic. So as soon as I received that medication, I completely relaxed, got some colour back in my face, and I felt like I could actually cope with the rest of the night and what it had to bring for us. So it was very good that we were proactive in asking for that assistance, and it was great that they gave it. So don't be backwards in asking for help if you need it. And then comes pathology wait, which you don't get for a couple of days. And the treatment plan hinges on the pathology. So you have a couple of days for your imagination to go completely wild. So it was really important that we stayed focused on what we knew and not to allow our imaginations to run wild, which is really difficult. But we kept each other intact and just made sure that we stayed focused on what we knew, and we didn't go running off thinking all sorts of things until we actually had the facts. I had heard about some women that hadn't looked at their breast post-surgery for a good couple of weeks. I was unable to do that. I needed to look at it ASAP. I couldn't cope with continuing to wonder what the outcome was, and I needed to do it pretty quickly. So as soon as my drains were removed, I took the opportunity to take my bandages off and have a look at the outcome. It's certainly your own 9/11 and there is a crash and burn, but it was fortuitous that I had a breast care nurse in the room at that time, or perhaps it was by design on their part, but it was certainly great to have them there. They said all the right things, did all the right things, and left me with a ton of information on nipple reconstruction and even a brochure on bikinis. So by the end of the day, I was feeling pretty comfortable with where I was at, and I would actually hate to think what it would be like to go through that crash and burn by yourself at home afterwards, without having anyone there to support you through that. So they are worth their weight in gold, those breast nurses. Here's a peek at my surgeon's handiwork. It's known as either a very large lumpectomy or a modified mastectomy. I had a fantastic surgeon that was able to leave me with a little bit of breast tissue from the surgery. And I already had an addiction to Victoria's Secret bras. So a good Victoria's Secret push-up bra and a little bit of extra padding. And I had a pretty good set of boobs. And the average person couldn't tell any difference. So I was able to solve my bra dilemma pretty quickly. I did have a couple of breasty friends that took a while to sort out their bra dilemma and tended to procrastinate on it. Looking back, I'm pleased that I was able to sort mine out pretty quickly. It allowed me to move on and sort of face the next issue, not have to keep thinking every day, what am I going to wear, what's going to work, what's going to feel good. So I think that's a good tip, is that as soon as you can, sort out your bra scenario so that you feel pretty comfortable. A few weeks after my surgery, I took myself off to the Zap House. And the Zap House focused on a couple of techniques. One is the NES system, NES, which is Nutri-Energetic System. And it functions on the basis that our body and our cells constantly vibrate and give a body field. And they can measure that body field and give you some treatment for that. Those treatments are almost like homeopathics, and you get them in little bottles, and they affect different systems or different energy fields within your body. They actually have one that's similar to Rescue Remedy, which I was guzzling at before I went into surgery, but very effective. The other thing they have is what's called Skeena device, and I think that stands for something like Self-Controlled Energo Neuroadaptive Regulator. And I didn't own one of those at that point, but this is what it looks like. And I would go to the Zap House and get treatments. And this little device was designed by the Russian astronauts to take into space because they couldn't take hypodermic needles. And it's a bit like a TENS machine, but it's the 10th generation TENS machine. And it facilitates your body to heal itself. So I would get a number of treatments on my scar with the Skeena device. And it certainly improved the bruising and also the angriness around the scar from the very first treatment. And I'd had the opportunity to use NES and Skeena a couple of years earlier when I incurred a snow skiing injury in Japan. So I knew that it worked. So it's very good. I've got some information on the links page for you on both those, the NES and the Skeena. And as you can see, I now own one of these, and to be honest, it saved me going through chemo, but more on that later. I left hospital with all the right information from the physiotherapist on what stretching regime was required in order to ensure that I didn't get any tightness under the armpit. But nevertheless, 3 to 4 weeks after my surgery, I was getting some tightness under my armpit, and it increased till it was about 1 inch wide. It wasn't a good look. Here's a picture. I called it my winged keel, and I had a minor panic over that. So I went to a physiotherapist and had some pretty intensive physio sessions on that for a good 4 to 6 weeks. And by chance, and I can't remember why, I wasn't able to get to my physio for a couple of weeks, and noticed that just with my continued stretching and my Skeena on my armpit, that it sorted itself out a good 4, 6 weeks after that. The research found that it was actually called axillary web syndrome, and it is fairly normal, and it does sort itself out with stretching after about 8 to 12 weeks. So if I can save you having a minor panic and a few physiotherapy treatments, then that's good. It is normal and it doesn't look good, but it doesn't last. Although I must say that if I don't do some stretching or some yoga, I still have a little bit of tightness that runs down underneath my breast, down into my pelvis. So there's a bit of a tight band there that is there if I don't do any stretching. So I hope that one helps. We continued our communication strategy as per our diagnosis phase, which was we were only communicating with close friends, family and colleagues who needed to know what we were going through until we knew exactly what was happening. And once we knew that, which was a couple of days after surgery and the pathology came through and our treatment plan was defined, we then sent a mass email out to everyone and begged their forgiveness for not telling them, but to let them know what was happening in the future and that all our communications would still go through Bruce as a key point of communications, which really relieved the pressure from me having to reply and respond to people. But as I got through a recovery of my surgery, I was able to do that, but it was still good to keep that central point of communication running through Bruce. So what did I not do well that I certainly could have done better? And the key one there is income protection. The income protection that I was on required a 3-month wait prior to you being paid. And that 3-month wait started on your last day of work. Unfortunately, I was diagnosed on Christmas Eve and I had to go back to work 3 weeks later to do a 2-day handover. So there was a good 3 weeks that I actually lost because the start date for my income protection was in January when it could have been in December. Had I known that, I would have restructured my handover in another method. So in hindsight, I wish I had looked into my income protection aspect a lot earlier than I had, and that would be my advice to anyone out there is don't wait till after your surgery to look at income protection. Actually get in early and look what you need to do so that you don't miss the boat like I did.